Sustained. Yeah, good. I'm anxious to see the numbers on that. Yeah.
All right. Hello. Good morning, everyone. Welcome to the May meeting for the Homeless Response System Steering and Oversight Committee. Thanks, everyone, for joining this morning. We do have several members online today, including Mayor Stovall, Anna Allen, and Commissioner Singleton. So thank you guys for joining us virtually. And in the room, we have folks, and we'll go around the room in a second to say hi to everyone there. Just to give a quick agenda overview, we really are just going through our May quarterly data report. This is kind of the first time we're going to be looking at this data under our new KPIs and in the new report format. And so just excited to have a lot of time this morning to delve into that, and a lot of time to have a really good discussion on those things as well. So with that, why don't we go around and go into introductions? Ryan, why don't we start with you?
Morning, everybody. My name is Ryan Divert. I use he, him pronouns. I'm the Deputy Director here with the Homelessness Response System. Glad to be with you this morning.
Thank you.
Hi, I'm Lori Kelly. I use she, her pronouns. I'm the Planning and Evaluation Manager in the Homeless Services Department.
Good morning, everyone. Anna Plum, she, her pronouns, Deputy Director for Multnomah County Homeless Services Department.
Morning, everyone. Michael Boncourt, Interim Executive Director for Home Forward, year 20, and also Dig 5.
Good perspective, Michael. Morning, Jessica Vega Peterson, Multnomah County Chair. I use she, her pronouns.
Hi, Eric Zimmerman, City Councilor.
Mayor Wilson, good morning.
Morning. Laura Suarez, she, her pronouns, behavioral health expert.
Jillian Shooney, Director of Homelessness Response System. Welcome, everyone.
Hi, Robin Johnson. I use she or they pronouns. You can also use my name. I'm a policy advisor in the Homelessness Response System team.
Maggie Williams, policy advisor with Response System. We can then hop online with Mayor Stovall.
Mayor Travis Stovall, Mayor Gresham.
Anna, do you want to go?
Good morning, everybody. Anna Allen, she, her pronouns, serve on the committee as somebody living outside of City of Portland limits out in East County. Happy to be here this morning, and thanks for the flexibility on being virtual. I do have a little one home from school today, and so if I am off camera for much of the meeting, that's why. Thanks.
Thanks, Anna.
And Commissioner Singleton.
Good morning, all. Shannon Singleton, she, her pronouns, Commissioner for Multnomah County District 2.
All right, thank you, Commissioner. All right, so as I said, this is our May meeting. This is actually our last meeting before our respective budgets for the City of Portland, Multnomah County, and I believe the City of Gresham are adopted for the next fiscal year. So the goal for this meeting is really to be grounded in the new KPIs, using the most recent data that we have, which is going to help guide us as we set goals in the upcoming meeting, kind of post-budget. And these are the KPIs, again, that were approved by both the Multnomah County Board of Commissioners and the Portland City Council late last year. And we're going to have lots of time for questions and discussion following the presentation that Ryan's going to give. If there are updates that folks have, we're gonna do that at the end of today's meeting. And with that, I will pass it over to Ryan. Good morning.
Great. Yeah, I just want to, we had as you can see by the agenda, we had envisioned sort of going through the report top to bottom and then holding questions toward the end. Does anybody have a strong feeling about, as I was thinking about it last night, pausing after each section? But we can just go with the flow. If after we do the grounding section, you'll feel like you need to ask some very detailed questions to learn about that and then move on, we'll just be flexible in that way. So next slide. And again, next slide. Thank you, Maggie. So first, we just updated our timeline to mark where we are now in May, providing you the preliminary report as promised. So this is the foundational discussion, as the chair said, to prepare you for the goal setting conversations that we'll have over the next several months after budgets have passed, and that will continue through September, the month that your goal setting decisions need to be final. That's like the back end hard deadline, right? I truly do think it's going to take 4 meetings total, but please know that the reason why we need to have these done in September is because we then need to have a joint work session in October to share all the decisions that you have made in preparation for the fiscal year 28 budget process. I think y'all are aware that departments and bureaus start getting to work in October for the following fiscal year. So we need to have our decisions made. Next slide. And just to show you this again, you've seen this graphic before. So today on the graph, we're hanging out in the magenta space with an eye toward the green space, the foundational discussion and the opportunity for you to ask questions. So please, as Ryan does go through each of the KPIs and KEIs, note your questions and curiosities on the paper that you have, whether they are things that we can answer today or you need more information on in the next meeting. Next month, again, budgets are final, June 4th for the county, June 17th for the city. So we all wake up on June 18th and our collective trajectory is set related to our main strategies around eviction prevention, our shelter programs, and our housing placement funding levels that are the main drivers of inflow and outflow. So after the dust settles on all of those decisions that all of the governing bodies will make, we'll come prepared to take a deeper dive on the few of the KPIs, probably housing production and behavioral health, plus any others you direct us to include after today. We also know that y'all want to have an initial discussion on various strategies, program level sub-indicators that exist. It is at the strategy and program level where we can set intermediate goals for the fiscal year based on approved budgets that we can track and celebrate along the way. So in other words, in the second meeting, we'll take a deeper dive on some of the KPIs, but then we'll start hanging out in the blue and the orange area a little bit to list out all of the sub indicators and associated goals, many of which y'all have already expressed an interest around. So we're making a list to bring to you for discussion. And then of course, right after that, all of it gets, the budget's passed and everything is implemented. It flows down to the contract level. Oversight happens over the course of the fiscal year. People get served and that outcome data is what flows back up to inform where we're at when we look at fiscal year 28. So with that, I'm going to go hand it off to Ryan to go through the quarterly report.
All right. Morning, everybody. We're going to devote a good chunk of today, probably about 30 minutes worth of presenting, but we can interweave that with as much discussion as you want because we're preserving about an hour at the end for discussion and questions as well. So we have an hour and a half total really to ground ourselves in the new quarterly report format. You deliberated on those KPIs over several meetings in the course of the last year. The council and the board approved these KPIs back in December. Some of the data that we're going to review today is going to look really familiar. You've been seeing touch points on this all throughout our meetings. But some of these you'll be seeing for the first time today. So we'll spend some time trying to describe how the KPIs are measured, how they work, what they can tell us. And you'll see in the quarterly report format, we're sharing out. We're giving you a preview of this morning and then posting that preliminary quarterly report publicly later today. You'll see in that preliminary quarterly report, it's really set up as an introduction to these KPIs. So what are we actually measuring and why are we measuring it? What does it help to tell us and what can you do about it? So really trying just to introduce those and help folks understand where we are. Just last general note, these key performance indicators are really here to help you understand more about the broader conditions in which our homelessness response system is functioning, but also whether those systems are functioning sufficiently, and I would say even more importantly, at a sufficient scale to meet the levels of need that we're currently experiencing. And I think especially in the current environment, I think these are really challenging and sobering conversations, but I think they're exactly the discussions that our elected legislative bodies have charged this committee to engage in. So glad to be walking through those with you. If you go to the next slide, we're going to start sharing these key performance indicators in the order we've organized them in our recent quarterly report document. So we include the old numbers. So you remember when we approved those, we numbered each of the KPIs. We include them for reference, but we've opted to organize them in a little bit different order that I think makes more sense as a narrative flow. So we're going to start with our broad, what we call grounding indicators, and then move forward to detail on inflow, safety on and off the streets, and outflow. So just to kind of narrate you where we're going today. If you go to the next slide, the first of our KPIs, we've talked about this one before. This is the first time you've seen it visualized this particular way, but we're looking here at our deeply affordable housing supply, since the availability and affordability of housing is the primary driver of homelessness across our communities. So this indicator is produced for us by the Portland Housing Bureau. It has essentially two components. So first, there's census data that tallies the total number of renter households with extremely low incomes. So that means they have incomes that are 30% or below the area median income. So just for reference, that's below $27,000 a year for a single person household, or about $38,500 for a family of four. The most recent census data put that at about 36,700 households across Multnomah County. So that's the first part of this metric. Then the Housing Bureau brings in how many regulated affordable rental units we have with rents that are affordable to folks at 30% of the area median income. So right now that's at 13,870. So when you divide those two, you get the metric, which is that there are about 37.78 there are about 37.78 affordable units that exist for every 100 extremely low income renter households. It's not directly part of the KPI, but we do note here that the same census data indicate that a little more than 2/3 of those extremely low income households are paying more than half of their monthly income to rent. So again, that sort of reflects that general mismatch between affordable housing need and our supply of affordable housing. And it also reflects the really significant financial pressures that put these particular households at higher risk of becoming homeless. So if you reference the little cheat sheet that we put together, that is your guide to goal setting associated with all of these KPIs, you'll see that this is one of the KPIs that you'll be setting a specific numeric goal for this summer. So to help you do that, we're going to use these data as baseline. PHB is going to help us understand how many affordable, deeply affordable housing units are in the current production pipeline. Think about other policy and investment strategies that we could pursue to get to additional deeply affordable units. And that'll help us help ground you in setting a new numeric target for this KPI. So for instance, that would look like setting a goal that says we want to move from 37.78 units per 100 households to 41, as an example. So we'll dig deep on that discussion earlier this summer. If we can go to the next slide, we're just going to kind of march through each of these key performance indicators. If you want to stop at the end of each with questions, that's fine. Or if you have individual questions about the individual indicator, let me know. They look like you might. Okay, great. All right, so on the next slide, this is a familiar graph to all of you by name. This is the by name list of people accessing publicly funded homeless services throughout Multnomah County, city or county funded. So we use this to track the estimated total number of people experiencing homelessness in Multnomah County. I think of this as our primary system measure because it helps us understand both whether our services to respond to homelessness are effective, but more so whether they're appropriately scaled to meet the needs that we're actually seeing. So again, this trend, this upward trend that you see here is occurring in spite of our sheltering and housing more people than ever before. But as of, just to check in, as of March 2026, this measure has us just shy of 18,500 people. And that continues a roughly 1.2% month-to-month increase. And it caps a roughly 21.2% increase since last March. So this is also one of those KPIs in orange for which you'll be setting a goal this summer. You've already seen how we've approached some of that work during the budget season. So we're going to start with our baseline as of the end of June, wherever this graph is as of the end of June. Then we're going to take our best estimates of the inflow and outflow impacts of city and county budgets that pass in their final form. We're going to project that forward and help you consider a range of scenarios for how you could bend the curve differently through the end of fiscal year 28. So it's a 2-year goal setting process. It's how that's been adopted. So together, that would help you set a goal that would read, for example, reduce net homelessness by X% over 2 years. Okay. So this is one we've seen and used often. Next slide. Again, this should be a familiar slide for all of you. Over the past 2 years, inflow to homelessness, which is the green line here at the top, has consistently outpaced outflow, so that orange line below. On average, over the past 6 months, that's been a gap of about 380 more people entering homelessness each month than leaving. I think it's worth noting here, and we'll talk about it a little bit more in a slide coming up, that pretty big bump in outflow in March, driven by more than 500 people who exited homelessness to housing. But again, the monthly volume of movement through the population of folks experiencing homelessness is pretty large. So on average, we're seeing a little more than 1,700 folks entering homelessness each month, and roughly 3/4 of whom haven't accessed our services before. And then we're seeing a little more than 1,300 people exiting homelessness each. About 1/3 of those exiting to permanent housing. And we'll talk a bit more about that on the slide coming up. The KPIs that the legislative bodies adopted moving forward both cover these numbers generally, and then a fair amount of detail on inflow and outflows. You'll get to see that here today. And I'll talk about the goal setting associated with inflow and outflow as we get to detail slides. If we can go to the next. That's the end of our grounding indicators. If folks want to pause for questions, or we can just keep going.
We've talked about this inflow 1,700 a month number now for a while, and I'm trying to get a sense of what level of data we have on those. So as a person identifies, so to make the list of 17, you have to basically have access to service. You become now a by name list member, so to speak. So aside from their name, what kind of stuff do we gather? And I say that with a couple of like optional questions, which is new to our list because we're getting so much better at the by name list, and they've been in our system a long time, but now we're finally getting that engagement. New to our system because they have hit the, the narrative, which is like poverty-based homeless or poverty-based issues have now just forced out, rent has gone up, that kind of situation where you've slipped into homelessness, have arrived in Portland, but were homeless. Like those types of fidelity of data would be helpful to understand the 17. I think we've given it enough time to now recognize that it's occurring, but I have no ability to articulate what the 1,700 represent. And I'm just curious what kind of data or where we might go on that.
Or a finer point, Ryan, maybe a list of what those service accesses are like, so we can know what that is instead of an aggregate number. Excuse me, Eric.
That's okay.
Excuse me, Counselor. So we know what access of service means. Is it doubled up? Is someone came into Bud Clark for a shower? Is it somebody, you know what I mean?
Yeah, and this is really helpful discussion. As Jillian described, as we head into the summer, we're going to be identifying like what are those helpful sub-indicators. What's going to help you have that additional level of nuance to guide this. So this is helpful discussion, but just without getting overly specific, what I can say is everyone who comes on to the by name list has an entry into a program inside of HMIS. And there's a series of standard questions that are asked at every program entry. So they include basic demographics, but it also usually includes questions about where folks are coming from in terms of their most recent living situation. It also includes data about the length of time that they've experienced homelessness prior to coming into that service.
Are we prepared to start sharing that? Because we've had now a few months of 1,700 a month, right? Where we've heard this number. Are we prepared to start talking about that? Because from a budgeting perspective, I have no idea if our current model is meeting this or not in the specific sense, not in the large sense, right? Obviously, in the large sense, it's not, but I can't attack a problem if I don't know what that data says. That's what I'm trying to see is when do we see that?
Yeah. And I mean, I'm going to defer that all of these data are maintained and the reporting produced by the Homeless Services Department. We have folks.
We can produce some of this right now, but we're actually in the process right now moving it into something we have called a data mart where we can actually slice and dice it really effectively. So in a couple of months, we'll be able to do things not just on these levels, but with frequency, meaning has it changed in 3 months? Are we seeing people from different spaces? We can get you a list of things that are most easily filterable and manageable. We can also get you a list of the types of services that we're seeing people land in. Beyond that, let me just follow up with a list of things I think what would be helpful rather than just giving you a ton of data is to understand what would be most critical.
Yeah, and I'm not asking for a data dump so much as like maybe planting the flag of like, I think it is time for us to get into that.
Yeah.
When it's downgraded to a level that is consumable, based on the presentation we had last month with Health Share and different mental health populations, I just think there is a specificity now that we have acknowledged this number, but what does it mean?
Yep.
And what types of injections do we need to make to arrest that data dump, in terms of 1,700 a month? Thanks.
So hold on. I just want to, so we've got Commissioner Singleton, Mayor Stovall, with their hands up. And then I also wanted to say something. So I want to make sure we have time for them too. Commissioner Singleton.
Thank you. I wanted to go back to the first supply of affordable housing. I thank you, PHB, for all the data. And also, I think we've got to talk about the pipeline. That's a question I asked during our last joint session. And I think it's important for us to know what's coming down the line particularly for 0 to 30. I'm also curious how we're getting data countywide for affordable housing and not just City of Portland.
Mm-hmm.
Yeah, and we can have the Housing Bureau follow up with both of those. In fact, I think it's next month that we have this on tap for sort of a deep dive look, where I think we can really get to exactly those questions for you.
Well, I guess I guess that's the question though, is does the Housing Bureau and maybe Mayor Stovall has more to say about this, but I think when we think about affordable housing, right, we're not just housing people in the City of Portland. And so if we're only looking at that slice of data, we're missing the broader county picture.
Yeah, and just to be clear, in the reporting that PHB sent us, they differentiated these numbers just within the City of Portland and then more broadly within Multnomah County, including the affordable housing stock. So I don't know the specifics of how they pulled those separately, but they did pull them separately, and we're using the countywide data here.
Great, thank you.
Okay, Mayor Stovall.
Thank you, Commissioner Singleton, in referencing that, and thank you, Chair. I was literally going to ask one of the same questions was along the housing inventory. So you nailed it. That was one of my key questions. My second question is really about more of the by name list. And on the chart that we share, I mean, that chart incorporates the historical pit count against the by name list. Is that correct?
Oh.
So this is if you go back one slide, Maggie, I think you're speaking to this one, Mayor.
That's correct.
Yeah, so this reflects actual service utilization going back to January 2024. So this is only that by name list. It doesn't pull in separately point in time count data. I would say it's sort
Perfect.
of
Okay.
Yeah, it replaces that data effectively.
All right, excellent. That's what I was wondering is this a compilation of different data sets and the way we're counting things, or is this consistent across? And this is services delivered. So that answers that question. Secondarily, when we think about the new by name opportunity and by name list, even as opposed to what we're looking at here from a services access, we my assumption is that at some point we're going to get more granular data from the by name list as opposed to historical ways of point in time counts and those types of things. That gives us better insight on specifically tracking kind of specific areas and of opportunity that we're seeing this increase that Councilor Zimmerman was just talking about, this 1,700 folks that are which is our inflow. We're going to be my assumption is that at some point we're going to get more granular data so that we can actually have deeper conversations about, are there key areas around the region, key areas around the county that we're seeing some of the homelessness start, stop, whatever it is. Is that a right assumption that we are going to be able to, now that we're doing a by name list specifically, be able to start to have more granular data and information and tracking across the entire county?
So there's a little bit of a yes and there. And I think when we're talking about sort of what more granular data we can have, it'd be good to maybe have a discussion around what questions do you want to answer about inflow, and then what do we have that could help us understand those policy questions. That could be, might be better to start with the question than like, here's all the fields we could collect. On the geographic thing, Mayor Stovall, it's a little bit tricky. We have not historically consistently collected geographic data about where people are accessing services. We are building that in. Our outreach services, for example, now sort of ad hoc outside of the system are collecting better geographic data, and we can use that to understand where folks are accessing outreach. The new HMIS system will have like geographic coding of where people are when they're accessing services. So that will be better in the sort of medium term, but not the short term.
Yeah,
Excellent. All right.
the only thing I will add to that too is you're going to get a geographic foot of where they're accessing services, but it won't necessarily indicate where they slept the night before. So that's another shortcoming of that. And people, you know, from the pathways report move physically a lot across the city. So it might not give you a completely accurate defense of where people are, but we can do what we can do as we move forward to begin to get towards that where they're accessing services.
Okay, as we get
Okay,
into
just quickly, one follow up. And so basically, even though we're doing the by name list and our outreach workers are capturing that, we're not necessarily right now and currently capturing that geographic information to actually be able to have a better understanding of, kind of similar to what you've just referenced, kind of where this individual slept last night. We don't quite have the plan in place to actually go deeper into that information. But I get it. I think you're spot on. Having the question that we want answered is going to help us identify exactly kind of what data collection we want. So appreciate it.
Okay, thanks. So a couple things, and I actually love, because like some of the things I was bringing up was Mayor Stovall dived right into. So thank you, Mayor. So one was the geographic. Like I think that the data. One of the limitations for me has been the lack of being able to kind of pinpoint some of this geographic information as we're trying to understand what people experiencing homelessness, where they are in the county, and how we can best align, the services and the resources to where folks are. And so I think that's something that we need to figure out. Is there an additional data point that we may need to look at in order to really get the best sense possible of understanding that information? So that's, I want to open up that possibility as we're talking about data. I think the second thing, and it's kind of a shout out, Lori, to you and all the folks that are working on the data team. The software that we're using for HMIS is so limited. And one of the biggest limitations is our ability to have reporting out from that information. So the data mart, and this is kind of like the second or third data mart that I know that the team has been working on over the years, is really the way that our data people are trying to make up for really bad software. So I think we're all excited about the transition to a new software system. But just this reporting out and being able to tease that out is going to be is something that I appreciate all the work that's gone into it. And it's going to be, I think a scale better with our new software system that we'll have in a couple of years. Right, so it sounds like one thing that we should do before the next meeting is maybe send something out to all the folks on the SOC in terms of what kind of policy questions or that they want to have data to help answer. right?
Yeah, so we'll get back to, well, one, I would love Counselor Zimmerman in particular, what questions do you want to ask? And then we'll align that with what the data, what can actually be pulled. So let's you and I meet.
Okay.
In addition to that, that's sort of like the data, but the pathways report, and I'll send that around again, is really more the why. The why is largely people can't afford to live in their, it's like they just can't pay rent. Financial instability is the leading reason why people become homeless. There's a lot of associated trauma that also happens, but that's it. Like they can't afford rents, period. That's the why. But we can give you the data about how they're intersecting with the system. And a lot of these people don't necessarily come to us immediately. They're homeless for a while. And then they engage in services and then they pop up on our list. So you'll see that in the pathways data as well.
And Mayor, well, I see 3 cards up. Chair, I don't know if you want to.
It was up before Mike. Sorry. I was just talking. Okay, so what, Michael, do you remember who was up first? Okay, Laura, Mayor, Commissioner Singleton.
Can we go back to slide 9? Oh, just one back. So, I think picking up on what Jillian just said, you know, what this shows is that there are over 20,000 households who are very precariously housed. And the public conversation that's happening right now is about slide 10, which is how can we have all of these vacancies and all of these homeless people? And what do we know about who's becoming homeless? And it's these folks, right? And so I don't think it's wrong to ask the question of why this, when this. But I think we can't skip over this in that question, right? It is a policy choice. I'm not saying it's the wrong policy choice, but it is a policy choice to say the folks who are on the street and these vacancies have to equate. And then we'll just wait for these folks to plunge into homelessness. And then we'll cycle them into the other one. So everybody knows this, but I think because there is such a public conversation about this and this, that I think we both have to wrestle explicitly with the policy choices and then also consider how we're helping the public think about this reality.
We need to move forward, right?
Okay.
Yeah.
And that is in fact why we put this front and center in the report, because it is the driver. So
I can skip my question. I can follow it back up. We do have discussion time at the end for folks too, so we can delve into some of this. Mayor, did you have something?
Yeah, just clarification. I think, Laura, you had noted currently the HMIS does not capture where they slept last night, which is a question we get on the pit count, correct? Okay. And so is that something that we'll have some access to, or at some point?
The new HMIS system does have the ability to drop a pin and do better geography mapping. So that's one of the reasons we're incredibly
Great.
So we can get you the latest pit data about folks. Yeah.
Okay, but is the current 18,000, does that question get asked on that 18,000? It doesn't. Okay, great.
Commissioner Singleton.
I think it might be helpful to share out, Jillian, the data points that are actually asked as part of the by name list, so that people understand what's being asked there. I think if you ask us what questions we have, I don't want to end up in a conversation of why we can't collect that data. It would be helpful for folks to know what we do already collect as part of by name.
Yeah, we can do that. And maybe what we're also going to be able to collect in the next iteration if it's something that we can't do quite yet. Yeah, thank you. That's a great idea, Commissioner. Okay, back over to you, Ryan.
all right, so we're going to transition from those grounding indicators now into the detailed indicators that focus on the inflow side of the equation. We're going to start there with two, we are calling these now key environmental indicators. We're adopting some nomenclature that Metro is using in their goal setting process. to really indicate that these are less about system performance than they are about understanding the broader inflow pressures for which we have relatively low direct control on the homeless services side. So the first of those, if we can go to the next slide, is tracking eviction judgments. So these are data from the Evicted in Oregon website that's maintained by Portland State University. It uses statewide eviction court data disaggregated by county. So this is looking just at Multnomah County's numbers. We've talked through some of these eviction data before, but just as a reminder, not every eviction judgment results in someone becoming homeless, and not every dismissal of an eviction means that somebody retains their housing. But because more than 93% of the eviction filings in Multnomah County are for non-payment of rent, tracking the overall volume of eviction filings and judgments helps us understand whether economic inflow pressures are increasing or decreasing outside of the homeless services system and in the broader rental market. So over the last year or so, we've seen an average of a little over 1,000 eviction cases each month. About 15% of those resulted in an eviction judgment. So 85% of those were dismissed. As a key environmental indicator, you won't be setting any goals around this indicator, but we will track it for trends to help you understand what's happening in the broader rental market. I think it's worth noting in the services tracking trends that the slight uptick over the past 2 months in eviction judgments. Again, we'll continue tracking that as a trend and report back. If we go to the next slide, the second key environmental indicator gets at another piece of what you were talking about, Michael, looking at households who are at high risk of becoming homeless. So this is an estimate of people who are in those extremely low income households, again, 30% of area median income or below, who are doubled up. This uses meaning that they're not the primary leaseholder, or they don't own the housing that they're living in. So they're not homeless, but they're not on the lease. Chose to track this because a fair amount of research, both locally and nationally, shows that folks rarely go directly from housing directly into homelessness. But instead, I should say, rarely from housing that they're actually renting, where they're the primary leaseholder, directly into homelessness. Instead, folks tend to live temporarily with family, friends, or neighbors. So this number is pulled as a subset of American Community Survey data. It uses the same methodology that we've used in past point-in-time count estimates of doubled up populations. It's really meant to give you a sense of, on any given night in Multnomah County, how many households might be doubled up and at significant risk of homelessness. The data are only updated annually, and they represent ACS data that was released looking a year back. So the 2025 data are going to be updated this fall. So it does lag a little bit, but as a KEI, we're going to help you track this number for trends. Future reports are going to look back several years and add to this. This is just the number from 2024. And as 2025 is updated, we'll add that into the mix as well. So in general, if this number is increasing over time, it suggests increasing inflow pressure on the system, more households who are doubled up and at risk of homelessness. If it's decreasing, it would suggest that inflow pressures may be diminishing. Next slide. So this is a new slide, I think, in terms of for this committee, but it's one that's actually always available on the Homeless Services Department system-wide dashboard. So this basically takes that inflow line from the previous inflow-outflow graph and breaks it out into detail in terms of how folks are coming in, or where folks are coming into the system from, in terms of whether they're new to the system, returning from permanent housing, or returning from inactivity on the list. So two of our key performance indicators show up here. First of all, this reflects the total inflow. So that's all of the stacked bars together for each month. Again, currently that's 1,715 people on average over the past 6 months. And then the other KPIs that this tracks is the subset of people returning to homelessness from permanent housing. So that's that middle green portion of each of those monthly bars. So on average, that's been about 230 people per month over the last 6 months. So again, the vast majority, almost 3/4 of folks who are coming into homelessness each month are new to our systems, but there is that smaller subset returning from permanent housing. And that points to additional or improved services that we may need to help people retain their housing. So referencing again your goal setting guide, you're going to be tracking net reductions in inflow, the total number, without setting a specific goal or numeric target. So this is one of those indicate direction metrics. You're going to be looking for inflow to go down. And then we'll be tracking again without a specific numerical returns to homelessness from permanent housing. So that's one of those blue system indicator no goal metrics. Next slide will be the last of our inflow specific metrics. This is also a new one, but also one that we've talked about in this group before. So this we pull from our combined HMIS and Medicaid claims data set that we've developed in partnership with HealthShare. We've talked about that a fair amount here. And this helps us understand whether people with high acuity behavioral health conditions are exiting permanent housing to homelessness at higher rates than people who do not have similar conditions. So the folks who are in that high acuity behavioral health cohort are represented here in green. The folks in blue are folks who don't have high acuity behavioral health conditions but are in permanent housing. So if you're following in your printed copies, you'll note that we printed out with sample data, but we've been able to update what's on the screen with the actual data just this morning. So really appreciate the team at HealthShare doing some great work to finalize these preliminary analyses just in the last 24 hours. So you're literally seeing it on the screen, hot off the presses. Don't think that metaphor works at all, but when we publish our report later today, we're going to include this data. So
just describe why the participant numbers versus the percentages have got lower and higher inverse here. What is that telling us?
Because what was there as sample data is made up data.
No, I'm saying, but 4.2 equals 27. Is it 2,700?
That's a mistake. There should be a comma there. Apologies. It's 2,700.
Yeah, but then 4,000 represents 1.2. So what are we talking
All right. Yeah, let me help narrate that.
Thank you.
That's another question. Sorry. So there are currently in permanent housing, or actually this is a 2-year look back at who was in permanent housing in 2004 and 2024 and 2025. So during those 2 years, 4,000 people who did not have high acuity behavioral health conditions were in permanent housing. Got it. 1.2% of those people left that housing to homeless.
I got you now.
Yeah.
Thanks.
And so the cohort of folks with high acuity behavioral health conditions are smaller. It's about
3 times higher, 4 times higher almost in terms.
Exactly. So the rate at which folks in the high acuity behavioral health cohort left their permanent housing and returned to homelessness is about 3.5 times the rate of folks who don't have those high acuity behavioral health conditions. But it's really important not to miss the fact that these rates are both very low, both populations. So to have less than to have roughly only 4% of folks in permanent housing with high acuity behavioral health conditions exiting to homelessness means 96% of people did not. So important not to lose sight that these numbers are pretty low for both groups, and to note that it's 3.5 times higher for folks with high acuity behavioral health conditions. So this really is going to help us measure whether improving connections between behavioral health services and permanent housing services can narrow this gap over time.
And how we should collectively focus our efforts on funding with legislative and or budgets, correct?
Exactly.
Yeah,
Okay.
because
Number
Yeah.
7, like we can really wrap our arms around that.
yeah, well, and we need to, because the one thing that I was going to say is, I mean, this does show like there's a, higher prevalence of people who with high acute behavioral health, but it also doesn't quite speak to the complexity or the difficulty of getting those people into permanent housing in the first
And
place and how we
keeping
need,
them
yeah. But and what additional things we'll have to do to make sure that we get them into the housing.
This conversation, this is another one of the KPIs that you'll set a goal around.
Yeah.
And I think this is going to be a really dynamic conversation together with some of our permanent housing providers, some of our behavioral health providers, to understand where some of your sort of programmatic levers
I agree.
sit
Yep.
to be able to shape this. So
But this is on the list for deeper dive next meeting.
exactly.
Yeah.
So I'm actually really looking forward to that.
Yeah.
We're in the midst of piloting some work really to focus specifically on this right now. And
We've already started.
Yep. Okay. So that was it for our inflow side. Do you want to pause for questions or discussions there or move on?
Gotta keep rolling. Yeah. Actually pick it up a little bit, Ryan.
Okay, great.
Ryan is not a fast talker. Explainer.
Very informative.
Yeah.
Okay, I can definitely speed it up and or dumb it down. So,
That's perfect.
and just to share, folks, we have now covered 8 out of 12 of our KPIs. Okay, so we're moving through it. We're rounding home. So we'll transition to the specific indicators tracking relative to safety on and off the streets, and then move to the outflow specific indicators. So just 2 additional KPIs in this category. Next slide. So again, this is that same graph as our total population, but it just highlights specifically the subset of folks experiencing homelessness who are unsheltered. So that's what this KPI tracks. Currently, that's about 9,100 people. It's about half of folks on the by name list. You'll remember from the initial slide there that the total population has grown about 1.2% month to month and about 21% over the last year. So the population of people who are unsheltered has been growing at a slightly faster rate. That's in spite of record levels of shelter available across the community. So one way that I think about this is essentially the orange portion just above the unsheltered population. That's the folks who are sheltered at the end of any given month. That really reflects the community's shelter capacity overall. And then the unsheltered homelessness tends to increase or decrease primarily relative to our inflow and outflow dynamics. So this summer, you're going to be setting a specific goal relative just to the unsheltered homelessness population as a percentage of the total homeless population. So that's going to be closely tied to goal setting around the population as a whole, looking at those inflow outflow dynamics. We'll give you estimated projections from the 27 budgets, some scenarios to consider into 28. And then you'll be able to work on setting a goal moving forward. So that'll come later in the summer as we get to our actual baselines at the end of June.
Ryan, can I jump in here real quick? Where's the GIS? So certainly this will be important for between Stovall and Wilson. Where's the GIS? What's the timing on that one? Do you know, Anna?
So the timing on the GIS is late next year or
Late next year?
next year. But we have we have an interim thing that we're doing right now. So what we are doing right now is asking our outreach workers to collect data about where they're serving people outside of HMIS. So we're using a different system. So we are already collecting specifically for street outreach where that outreach is occurring by outreach zone. So we have like an interim that we're doing to better understand where folks are across the county.
Code?
Yeah.
What are you basing that on?
I need to check how they're.
Okay.
I can know. I mean, I will phone a friend and see what's.
Anything would be helpful for us. Yeah.
Yeah.
Mhm.
I'm just a little nervous with the
County resources.
Yeah, exactly.
Yeah.
So
I just want to say I very much appreciate the interest in the geographic piece of this, and the pick count map for the latest pick count I think will be very helpful. But again, this is a very mobile population, so
Yeah.
I don't want you solely hanging your hat on this.
Right.
Okay.
Yep.
All right.
Yeah.
Here we go.
All right, so the last of the two sub-indicators around safety on the streets, if you go a slide ahead, thank you. This looks really similar to the total population, but this is actually filtered to just show you folks who are experiencing chronic homelessness. So this is the portion of the overall population experiencing chronic homelessness. That's usually defined as folks with extremely low incomes, one or more disabling conditions, and long experiences of homelessness, usually 2 years or more. So you chose to track this KPI both as a way to understand some of the relative acuity within the overall population of folks experiencing homelessness, but also I think in recognition that functioning and well-resourced system helps to assure that people return to housing more quickly and you get fewer people entering chronic homelessness to begin with. So right now, roughly half of the total population experiencing homelessness is chronically homeless. Folks who are chronically homeless are unsheltered at slightly higher rates than the population as a whole. And increases to chronic homelessness have also slightly outpaced the increases in the population as a whole as well. So again, this is one of the KPIs that you're going to track for direction rather than setting a specific numeric goal around. So you're going to be looking for a net reduction in chronic homelessness without setting a specific goal. Next slide. So now we can finish out with two additional key KPIs that focus on detail around the outflow side of the equation. I think of this as the more hopeful side of our work for sure. So just like that earlier graph that split out detail on the inflow line, this is the graph that splits out detail on the outflow line. This is a new graph for the committee, but again, this is up on the Homeless Services Department dashboard always for reference, updated monthly. In addition to tracking out from homelessness, so again, that's the full stack bar for each month. We're going to be following a specific KPI to track the subset of those folks who exited to permanent housing. So that's the dark orange portion at the top of each bar. So the subset exiting to permanent housing has on average increased over the past 6 months compared to the last couple of years. March was actually the highest number that we've posted since we began tracking the by name list, with more than 500 people moving from homelessness into permanent housing. So those 500 people, it's worth noting, add to the more than 9,400 people that our collective programs, city and county, are currently helping to keep housed after they initially moved from homelessness into housing. So again, I think that this is the most hopeful part of the work, where we're able to make the most direct impact in shifting the inflow-outflow dynamic, because for every person that comes out to housing, it is 1-for-1 an increase in our outflow. So this summer, you'll be setting numeric goals for both the total number of people exiting homelessness, so a percent increase in that over time, and you'll be setting a goal around the specific number of people exiting homelessness to housing. So again, we'll similarly help you to bring you fiscal year 27 projections, some scenarios into 28. You can consider those goals and then make a decision. And then the last of our KPIs on the outflow side, this is a new one, so it'll take a little more explanation. This is looking just at people who have moved from homelessness into permanent housing. And then it looks back from the point that they moved into housing at how long they reported being homeless before they were housed. So this is the length of time that people reported that they experienced homelessness before they were housed. We haven't previously tracked this on dashboards, but this is one that you're going to be monitoring for a general downward trend. So we want the average length of time homeless to be decreasing. Worth noting that over the past year, this is already trending downward. As we start to track this KPI, this is one that's going to raise a lot of questions, and there are a lot of, I think, sub-indicators that will help us understand more about what's going on within this. For instance, here we're showing you both the average length of time homeless, that's the green, but then we're also showing you the median. And I'll explain really briefly why. So the average time people reported being homeless prior to being housed last quarter, so the folks who were housed last quarter, the average was 1,159 days, so a little more than 3 years that they were reporting being homeless before they were housed. But that average is really significantly skewed by a relatively small percentage of folks who reported being homeless for more than 10 years. So averages can get skewed by having outliers on either side. So if you look instead at the median, so in other words, if you listed everybody who was housed from the person who was homeless longest at the top and the person who was homeless for the shortest period of time at the bottom, the person exactly in the middle of that list reported that they were homeless for about 472 days. So about a year and a half. Roughly, to give you some sense here, roughly 2/3 of the people that were housed last quarter reported being housed for less, or being homeless for less than 2 years. So again, it's a little hard to work through.
That'd be great as a standard deviation.
Exactly.
Give us an idea.
Yeah, and we do have, we did actually map out a curve that we thought about showing you where you can see in bins how long folks were there. And we can help bring that in future.
And Ryan, I want to be clear because I haven't heard you say it yet. Maggie, something just happened with the screen. These are what they tell us, how long you have been homeless. This is not necessarily the number of days they were interacting with our system.
Yep.
So they may have been homeless for a couple of years as people who were homeless for 10 years. They may have been homeless for 7, 8, and then they've come into our system and eventually reach housing. So know that this is not service. This is qualitative. Tell us how long you've been homeless. Okay.
And
Oh, sorry.
so
But just to follow up on that, but we do have that other data point, right? Of like when they first came into our system and then, all right.
But this is one y'all added and this is how you wanted it.
No, I'm just saying that like,
We want to shift.
We
that.
could do it that way.
no,
Yeah.
I don't know that we need to. I think that this is like people's telling us what their experiences is very
Yeah.
important. And I think like if people are curious as terms of like when people first started getting services in Multnomah County, how long did it then take them to get into permanent housing would also be an important data point for us to have.
yeah, and
I think it's a great one.
the way to think about this is this works really well as a system indicator because it tells us in general, are folks being housed more quickly? Are they coming to our services or we're coming to them early in their experience as a homelessness?
Yeah.
Versus the other, when they entered our program and when they got housed, tells you how effective our programs are. This tells you how effective the system is. That's a helpful distinction.
So notably also, we changed how this question was asked in 2024. And so the data that is more recent is probably more accurate because it was asked like, I think it was not consistently asked of like, when was the beginning of this bout of homelessness? And more recently, that's more specifically how it's being asked. And so, we have some people in there who say that they have been homeless for 40 years. It's very possible that they have been, or it's very possible that that's actually a lot more cyclical experience of homelessness, but it's just showing up as that first date, and that's more accurate recently. So it'll give more accurate time too.
They'll say as we head into questions and discussion, we made it. That was literally KPIs. So this is the point where it's just broad open discussion and question.
Okay, great. So folks put their hands up or their table tents up if you want to get in the queue to speak, and we'll start with Commissioner Zimmerman.
Thank
Or
you.
Counselor Zimmerman.
It happens every day, every week. It's just a thing. I do it to Counselor Smith all the time.
Yeah.
So on slide 18, we're talking about the increase in the unsheltered. And I think most people know, like, this is probably the area I try to spend from a perspective of if we want any chance in hell of passing an SHS with the public, like this is the part for me that really pops. So if 1,700 per month are experiencing homelessness, my gut would expect that this 159 would be higher, because to experience homelessness is like this moment of deep crisis and you come into the list. So I was surprised that it's not a higher number.
Slide 18.
Sorry, yes.
Numbers change.
Oh yeah, I'm doing the one that is just the unsheltered, and it has there we go. That's great. Yep. So from that perspective, what do we account for the other 90% of the month to months that come in to our system as experiencing homelessness?
So the total population of folks, the total population is going up by about 380 per month, I think. That's right here on the. Sorry, 200. So 209 month to month was the last increase in the overall number. And that's because it's net inflow and outflow. So the difference between inflow and outflow comes in at 200 total. So the total population, all three of those bars went up by 209 people. And then the unsheltered portion was 159. So I think that's really
okay.
Yeah.
Okay, so this is helpful. And I say this, so we often get the talking point of 1,700 new. But then on slide 21, we see that we had 500 in March who moved into housing. So make that 1,200. I'm just doing rough math here, guys. All right. Then we've got people who hit the 91 day, so they fall off the list then because they're no longer considered. And so then we get into the 200, 159 to 200 is what we see in unsheltered new every day, or excuse me, month. Okay. That's helpful because there's more nuance to just the number 1,700. 1,700 is an indictment of our economic system and housing system, but not necessarily the sheltering. Okay. Then do I get a fucking gold sticker? Right. This is a broadcast meeting. I probably shouldn't have said that. But anyway, all right. So, and then I appreciated what you ended on, Ryan. I just wanted to say this, I actually think the average is helpful. Median is also helpful. And frankly, it tracks with those of us who are in the room when we had to make the difficult and very controversial decision about task sites in 2022, which was there was up to a 7-year waiting list for an affordable unit. And we kind of all looked at each other and said, that is ridiculous. And so we have to do something in the interim, which is a shitload more of pods, because 1,159 average days is nightmarish, but it does certainly track. And I think that as the data gets more mature from 2024, we'll see that trend here, but I do appreciate you adding it to it. And I want to make sure that I understand this also, that the final question here is, since we just got through the 159 number or the 202 number of unsheltered out of the 17, et cetera, that means that some of the 17 who are coming into homelessness every month are not in this 1159 or even near the 472. We're addressing it quite rapidly then. Okay. And so I say that because that will help me when we get to the data for what brought you into it. What questions do we want to ask? And this goes to some of the stuff with Health Share we shared last time. I'm getting more and more interested in investing more and more in what we're good at. And frankly, highlighting for the state where we need them to be better at. And I think that's a huge part of the population that we collectively, the county for a long time, the city now too, is obscuring a population. We're covering the state's work for them, but I want to invest in what we're good at, because there's some areas I feel like we're not set up to do, and maybe we shouldn't be spending money there at the expense of what we're really good at. So that's a balance for me, given these different numbers. So thanks, guys. That's all I got. Thanks, Jeff.
Okay, so this is the list that I've got. So Anna's next, Michael, Keith, Shannon, myself. We have about 22 minutes left, so everybody gets about 4 minutes if you want to kind of keep that in mind as you're talking. And that's like no time for them to answer back. So like you factor that into, okay, Michael.
Anna.
Oh, Anna, sorry, Anna, yes.
No, thank you, Chair. I appreciate all the information today. First of all, thank you. And if you hear cartoons in the background, I apologize. As the taxpayer representative, I think it's important that I'm just also thinking about this, and I think it's important that we connect these KPIs to like clear accountability and budget transparency. Especially because the county and the city are still finalizing their budgets and making major funding decisions tied to homelessness response. And we're headed into a long session, to Councilor Zimmerman's point too. And I'm thinking about that advocacy to a state level, and really thinking from a perspective as a taxpayer and accountability and governance. And so a lot of these metrics being described, they described desired outcomes, but I think taxpayers also need clarity around who is responsible for delivering those outcomes and what level of investment is attached to them. So I think, my question is, questions is really, we don't have to go down the list today. Obviously, I know that there's not going to be time for response, but I still want to pose the question of which agency or entity owns each KPI versus maybe contributes or helps to coordinate or fund some portion of, but who owns each KPI and who is ultimately accountable if targets are missed. And alongside that, what is the projected public cost associated with achieving each KPI target so that the public can better understand both the expected outcomes and the level of investment required to reach those KPIs. And then I just also think that helps to flow up into the state level budgeting that's going to be coming up. So.
And Anna, I appreciate you recognizing that is a very long and detailed answer. And let's set up a meeting, and we will also show you some of the budget projections work we've done as part of the budget process this year that I think will be of interest. I can send that around to everyone. Yeah. Well, y'all have seen it. Okay. Who's next? Chair here.
Okay, we've got Michael.
So this is a observation, maybe a suggestion, that as it relates to eviction judgments, which is a KEI, as we think about what sorts of things in the environment are impacting these indicators, I think something that might create sort of a surge, or that sort of lags what's happening in the economy, and maybe it's a sub-indicator, is economic vacancies and affordable housing. So what we've seen is an increase in evictions for non-payment of rent sort of in the rental market generally, and that has lagged in affordable housing properties because affordable housing providers are trying to not evict people for non-payment. But meanwhile, there are these big rent arrearages that are building up. And so rent assistance has largely run out. There are some eviction prevention funds, but providers can't sustain the level of non-payment of rent that they are, and it's likely to add to sort of like a surge or a glut in evictions for non-payment. And as a system, I think just anticipating that and maybe, again, I don't know if it's a sub-indicator of what that economic vacancy rate is, so we understand where that's potentially causing the numbers to spike, might be helpful.
I feel like we need to ask PHB.
Yes.
Okay. No longer.
Okay, great. Mayor Wilson?
And more for Lori and Anna. So going back to the data end, was the slide that has the aggregate numbers, and unsheltered shows the aggregate number. So currently, we don't ask, where did you sleep last night? So how do we qualify unsheltered, sheltered, and unknown? How are we getting that information?
It's their exit information. So when somebody is exiting a thing, they will say, tonight I'm sleeping outside, or they might say, I'm going to sleep with a friend, and we are going to log that. And then where they last were known on the last night of the month is going to people that information. There are some people who leave and just don't know where they're going. And you know what I mean? And so they're going to land into that unknown spot. There are also times where they just won't or don't tell us. That's also the unknown.
Okay, so, and then we're going to be asking that information while you're gaining service. Where did you sleep last night? And that'll give us an indicator of what happened last night, as opposed to not knowing where they're, well, they may or may not know. That's great.
We already asked both. We asked where are you coming from effectively, like what happened last night, and then when people leave, where are you going to? So where you're going to will be here, but where they came from will also be in our system.
That's where we're going.
Well, we already asked those.
Okay.
Great. Commissioner Singleton.
Thank you, Chair. I'm definitely concerned about the number of folks who are new to chronic homelessness. 202 people a month is a large number, and I don't know how we're using this to talk about PSH and our need there. So we don't obviously have time to talk about that whole thing, but I'd love for us to dig a little bit more into that. I think the other piece I'd love to know is some of these data points would be helpful to break down into demographic data. I haven't seen a lot of conversation about equity and how it shows up in our services. We know at least that Black and brown folks are underrepresented in the sheltered population compared to our rates in homelessness. And so I think unpacking some of that is also helpful to help us when it comes to program design and how we target specific investments. And then I would love, I don't know if it's on an agenda, Jillian, but talking about the Pathways report, I think would be helpful at some point. We talk very regularly here that there's like the way we talk about the data is there's like this linear pathway into housing, and that's not how it really is for the human beings on the ground. And I think there's so many lessons learned for how we can be designing systems, or frankly, how we direct nonprofits to staff this work. It's kind of odd to me when we think about the human being and their journey that they have how many times they change a case manager, for example, as opposed to our case manager just following that person through their journey. So when they leave shelter, they lose that person. So there's just a lot of the other kind of components underneath this that I think would be helpful for us to talk about at some point.
I asked you, is there a way for us to know how they were housed, by what mechanism, what type of housing? Like if that was a houseless veteran, did they use a VASH voucher and get through housing that way? Did they get through housing through an adult, like a long-term care? Like, are we able to sort of granulate?
Yes.
Okay, I think that would be great, because then that also identifies what agencies and are supporting that, and then what does that need, and then also an opportunity to where you guys are shifting support and funding.
I had two quick things.
Yes.
So on the this slide on our service dashboard, we are collecting, Commissioner, the race, ethnicity, age, and gender of folks who are accessing the services and who are in the population. So we collect that on the dashboard, and I believe all of the outcomes that where it is possible to disaggregate by those demographics, we will do so, correct?
Yeah, so as we launch, so this right now you're seeing this as a static paper-based report or PDF-based report. We're going to be launching in the summer dashboard for each of these indicators, and every one of those indicators will include disaggregation as we're able to by indicator. So that I think that'll help a lot with what you're asking for.
Can I clarify one quick thing on the what are we collecting about where were you the previous evening? It's not geographic. It's not like I was out in East Portland. It's I was in my car, or I was in a shelter, or I was with a friend. So it is like what type of place were you in, but it is not currently geographically oriented. Just to be
We care a lot.
moving toward.
As long as Clackamas County claims they've solved homelessness, care perfect.
Yeah. And let's keep going, Chair. Sorry. Any other?
We just want their SHS.
Yeah, right.
You don't need it. What?
Maggie, if you want to scroll down just to scratch this geographic itch real quick, go down. I threw in, this is the latest 2025 point in time map of that data.
So this is when we do ask where were you sleeping last night, like by area of the county. That's what this is.
So this, yeah, and these numbers are so low because it's just the point in time count.
Yes.
So but I mean, and I don't know, maybe this is a Lori question. Is this
It's a big deal.
like, can we extrapolate from that what we might be seeing in the by name list, or should we only like assume that this is just this little snapshot that we get with the point in time count?
can, so we do extrapolate from this location, but we don't extrapolate factors inside that location. So like we can't assume race, ethnicity and things.
Right, okay, yeah, yeah. Okay, all right, that's helpful. Thank you for putting this in here. Yeah, okay, so, my questions, Commissioner, I think Commissioner Singleton was done. So I really, really appreciate the conversations that we're having, in this meeting today. And I feel like we're digging in now to this next layer. Like we have the data, we're understanding the data, we're seeing kind of the trends in the data as it's going to lead us to, the goal setting we're going to do for the KPIs. And it feels like we're also on the next logical step is delving then into that policy conversation. Or what are the policies and strategies that this group thinks that we need to be leaning into over the next year or two to help really focus on some of these populations now, or these factors that we're seeing through the data. So I'm really interested in setting up some of the meetings over the course of the next several months after we've done our goal setting to really dig into that, because I think that will help set us up for next year's budget, right? When we're trying to figure out like what is the city, what is City of Gresham, what is HSD going into the next year. So to really use this, I'm really excited for that, for those policy conversations. I also, I think, when you were applauding Counselor Zimmerman for his like tying the data together, or I think that intersection of the data of like how that can be uplifted in these conversations into the public. Like we have this data point and this data point, and this is how they work together to really tell the story of what's going on. If we can bring that in a little bit more to the conversations, I think that's going to be helpful too. Okay. Great. So that's any other?
Of one more. So
Yes.
I just want to, so as we were going through the KPIs last year, I was very clear. I want more of a dashboard velocity of what it is. And you and I talked, and supported the KPIs, KEI, and the vote with the focus of having 4 or 5 key dashboard items at the front of this meeting that kind of address velocity in the moment, average days, average length of stay, reunification, so we can really draw into what are those National Alliance to End Homelessness key 5, right? And so I just want to let me put forward that in the next couple of days, work with you on that, and then start fleshing it out and ask Lori, if you don't mind, I'd like to present that every month to us, which is just a system dashboard velocity of what's the system doing right now. And then just talk, it's like 4 or 5, but I've talked to you and Anna, and I've talked about it multiple times. I want to really start talking about, you have such great, robust data that I don't, I want to look at that and test and monitor the velocity of the system today. Okay.
So I think that's what we'll really, when I say sub indicators,
Yeah, exactly.
So we'll have that'll be part of the discussion. And there are literally hundreds.
Absolutely.
So we'll bring a laundry list, and then y'all can discuss like what are the in addition to these 12 KPIs, what are the 4 or 5 sub indicators that you want us highlighting on a regular basis that are probably tied to the fiscal year, sort of that immediate performance. Yeah.
Sorry.
No, go ahead, Commissioner.
I think it is helpful, right? If we were a single organization and I was sitting at the head of that organization, I'd be like, okay, what are the ones that we have input on, so that the dashboard helps me from a weekly staff management perspective, or like, are we on the gas, or did we take our foot up a little bit, right? That's the type of thing. So as we do that, I'm going to be wondering, it's like, what kind of possibility might we have to, as the data dashboard is available, there will be different ones that are really important for you as the chair, for Mayor Stovall, for you as the mayor, for you guys as partners. And I wonder how each of it, like you might select different ones to see every week with your team as it relates to the Housing Bureau and our interactions with Home Forward, et cetera, which are going to be very different than yours, more in the social service side of it. And what are we doing? And that kind of attack mindset is, I think, you have to eventually pick out of the hundreds.
Yeah.
These are the crisis points I'm putting gas toward. And it's okay to just acknowledge not everything gets attention by me, because someone else gets some attention on that. And then here is where it's working together piece. So as we do that, I was thinking that as you're presenting today, Ryan, I'm like, all right, great data. Now I'm getting a little bit, I'm getting fatigue of new spreadsheet, and I'm going to want to start having month-to-month reference points for last month to this month spreadsheet or data points, if that makes sense. And I think that's a dashboard idea as well.
Thank you. Any other things for this discussion? Otherwise, we will move on to announcements and next steps.
Yeah, I sort of did this very quickly in the beginning, but
Oh, wait, so Commissioner Singleton, is this an announcement, Commissioner, or?
No, I just wanted to appreciate staff. This is a lot of different data that needs to be pulled, and I know we've been asking for it to be sliced and diced in different ways. So I just appreciate the work that's gone behind this, and I feel like we're moving in a good direction. So thank you, Lori and your team, and Jillian and your team. And I don't think Josh is here, but he's also been very responsive with Housing Bureau data.
Great, thank you, Commissioner.
Want to announce? You ready? Rose Festival begins next week, and we've got great parades, and the town's looking great, and there's a lot of hope. And I'm going to encourage all of you to come out and enjoy Portland.
Yeah, the first night of City Fest is tonight,
Yeah.
opening night. So
Pretty exciting.
I think there will be fireworks. So come on out. All right. I just wanted to share, and sorry, Anna, if this is stealing your thunder a little bit. Earlier this week, the Homeless Services Department released the official outreach manual, which is something that's been in the works for several months, which is really about kind of aligning the policies, the procedures, the structure of how street outreach is happening across the county, and really helping to move from more of like the crisis intervention or type to how are we really using outreach as a path to connection to further services and everything. And this builds on the work that has been going on in outreach for a couple of years now in terms of setting up outreach zones and really, looking at this as a system. And so I just want to give kudos and shout outs to the Home Service Department for this great work. And I think this is going to have a big impact on how this outreach work is done. I also think it's very important as we're talking about our constrained resources that outreach is happening is as effective as possible in providing a full scope of information to people that are being engaged with. We're seeing this in some of our budget reductions this year, is that like looking at how some of that information can be shared in other outreach that is happening more generally. So I think that this is a really great starting point. So just wanted to appreciate the department for all the work that's gone into this.
Is that just going to be public facing, like on your?
It is public facing. Yes, it is. So everybody can see it. They sent it out in their last newsletter, but we can send out a link to it after this meeting and some of the follow-up items. So, okay. And I think you said you were going to send out another link to the Pathways report, correct? Okay, great. Okay. Any other announcements for today? Okay. Thank you everyone so much for the discussion. We are going to meet again on June 26th from 9 to 10:30. Details will be forthcoming about location. Looking forward to the deeper dive into the KPIs and developing the goals now that we have all this amazing data based on the budgets that are going to be passed in the next month. So with that, we are adjourned. Thank you.
It's to your point. It's aggregated. So we education's county. So I'm going more of a not competition, but I want verification. Yeah, this is something we should be asking every single day.
Great. Are like that.
We're not doing it through housing. How much they